Okay. Which of the following is a common teratogenic effect associated with maternal cocaine use? A 26-year-old pregnant woman with a history of substance abuse is admitted to the hospital for prenatal care. She admits to using cocaine during her pregnancy. The physician explains the potential risks of cocaine during the pregnancy to the patient. Which of the following is a common teratogenic effect associated with cocaine use? Man, I would used to know this. Frick. I don't think it's polydactyly. I don't think it's anencephaly. Placental abruption, cleft lip and palate, and VSD. I am leaning towards placental abruption. I don't really remember here. I'll have to probably just, I'll probably just, I don't have a great reason for it, but I'll have to probably just, my mind is going to that.
Good. Yeah. Cocaine is a risk factor for placental eruption. Okay. Like I said, that's your gut answer. And I always mention this to all my students and also you that sometimes you can't pull it out to the forefront of your mind, but you've read it somewhere and you studied somewhere. So your gut's like, that's it. I just don't know why. Right. And so
Yeah,
definitely for sure, sometimes when you're stuck on these questions, you can't remember a factoid, you got to go with your gut, right? Because that's the best how do I say this? The best percentage that you're going to have chance of getting it right. You know what I'm trying to say?
for
So
sure.
definitely for sure, it's just kind of this is a little bit of a factoid, of course, but maternal cocaine increased risk for placental abruption, which, as you know, already know, right? A placental eruption just means abrupt, separation of the placenta from the uterine wall, right? Preterm birth, other complications, fetal hypoxia from placental eruption, which makes sense, right?
Mhm.
VSD, there's a bunch of things that can cause VSD. It's very, very common heart defect, right? Anencephaly, right? So things like valproic acid or folate deficiency, right? Cleft lip and palate, right? Some familial kind of genetic things that can increase your risk. It can be spontaneous, right? There's also different theories too that if kids suck their thumb at an early age and cause a cleft, I think that's one of the theories, right? But anyways,
Wow.
yeah. So just something interesting to know about. They're never going to test you. That polydactyly just kind of runs in the family too. It can, and also in some syndromes, right?